As part of a citywide effort to eliminate lead poisoning in Rochester by the year of 2010, the Coalition to Prevent Lead Poisoning held a rally for support at Rochester's Enrique Fermi School Number 17 recently, which featured a special visit from Senator Hillary Clinton, Congresswoman Louise Slaughter, Rochester Mayor Robert Duffy, Monroe County Executive Maggie Brooks, and many other dignitaries from around the state. The visit, which was the light of new initiatives to test children for hazardous blood lead levels, was a huge success and an eye-opening experience for the whole community. Students First was there to capture this very important gathering. Let's take a look.
I'm here today for several reasons. First, because ever since I went to work many, many years ago for the Children's Defense Fund, and in all the years since, I have been concerned about the elements in family life, in community life, and in the environment that hold back children from fulfilling their God-given potential. And one of those issues, which has been a deep concern of mine as well as so many here in this audience, has been the totally preventable problem of lead poisoning. And I'm here also because Rochester is a model for an innovative, proactive, collaborative initiative about what we can do as a community to try to help our children. Now, we've made a lot of progress in the last 10 years, but lead poisoning remains an important environmental risk, affecting the health and development of over 1 million children under the age of 6 nationwide. And while average lead poisoning rates in the population have declined in recent years, young children here in Monroe County still suffer from twice the rate of elevated blood lead levels compared with the rest of New York State. Minority and poor children are disproportionately at risk. And why? Because these children and their families are more likely to live in older housing with poorer building maintenance and greater risk of lead paint hazards. In fact, low-income children are 8 times more likely to develop lead poisoning than children from more affluent families. African American and Hispanic children are 5 times and 2 times, respectively, more likely to have toxic blood levels than Caucasian children. So although we've made progress, we've got to remain vigilant and focused on this issue, and to stay the course until we completely eliminate this entirely preventable childhood disease. There are a lot of heroes in this story here in the city and in the county. And I'm also very grateful for the federal government's role in helping us to combat lead poisoning. And I want to thank all of the representatives who are here, and I'll be introducing them in a minute. What we have now with the passage of the recent city ordinance and with the commitment of the county executive, with the mayor, with the city council, working hand in hand with advocates from the affected communities, the religious community, legal advocates, and so many more, is that we have in place a plan for Rochester really to be the model for the entire nation. Now, under the previous administration, the federal government established a national goal of ending childhood lead poisoning by 2010. And Rochester has tried to put its plans in motion to be able to have a community that is lead safe by 2010. If we pursue the plan and if we all work together, we can, I think, make that deadline or come very, very close. Why is that important? Well, we know that lead poisoning lowers a child's IQ. We know that lead poisoning interferes with the brain development. We know that lead poisoning interferes with emotional and impulse control, leading often to aggressive behavior. We know that the lead is in the environment, and it came from lead paint that was used for decades without any real understanding of the dangers that it caused. We also know that lead is found in other forms where children can get their hands on them. We've had recent fatalities here in New York and elsewhere when children swallowed small toys that were made with lead or chewed on jewelry that was made with lead. We've even had some problems with imported candies that had high levels of lead from other countries. So we have to be really aware of all the ways children can get lead into their mouths or that they can breathe lead dust. Despite a ban on lead paint in 1978, there are still over 24 million housing units in our country, about 1.2 million in New York alone, that have lead paint hazards. Now that's a lot of homes, and we can't just turn our backs on the fact that people live in those homes and need those homes. And while many homes have been what's called abated, in other words, the lead problem has been removed using federal dollars over the last 15 years, federal programs only have the resources to remove lead paint hazards from less than 1/10 of the millions of housing units remaining that still have the hazards. Now, at that pace, we wouldn't be able to end childhood lead poisoning by 3010, let alone 2010. So we've got to do more in outreach and education. We've got to get more homeowners and landlords to know what this risk is. And this is something that affects everybody because, you know, the costs of special education are directly related to children coming to school with the mental impairments caused by their exposure to lead poisoning. Our prisons are filled with people who are there with very high levels of lead in their body, who lost impulse control, who became aggressive, and unfortunately committed crimes. Now, what I'm introducing today, and I've done so in a bipartisan manner with 2 Republican senators and 1 other Democratic senator, is the Home Lead Safety Tax Credit Act to provide an incentive for homeowners and landlords in cities like Rochester to engage in the safe removal of lead-based hazards from their buildings. Specifically, it would provide a tax credit for lead abatement and remediation measures and would provide a cost-effective way of protecting the largest number of children in the near term. The credit is targeted to homes where children under 6 years of age are living, to women of childbearing age, to low-income residents, to buildings built before 1960, because these include more than 96% of all cases. In Massachusetts, a similar tax credit helped reduce the number of new cases of childhood lead poisoning by almost 2/3 in a decade. Obviously, we'd love to get something like this passed in New York, which would help us move forward in a more expeditious manner. But we do need a national approach as well. The Home Lead Safety Tax Credit Act would help homeowners make over 80,000 homes each year safe from lead, which is more than 10 times the number of homes that can be made lead safe by current federal programs with the amount of appropriations that they receive. So this is something that I feel very strongly about, as so many here do today. The costs of childhood lead poisoning are estimated to be over $43 billion alone in New York. That's health care costs, neonatal mortality, decreased intelligence, lost future income, special education, criminal justice, everything across the board. So I'm very proud that Rochester and Monroe County have been leading the way, and they're the ones who I hope we can make a pilot model program for the entire country.
We started because of Ralph Spezio, and I really have to praise him. I'm proud to be standing here, Ralph. the same place where you stood for years. For years, he was a lone voice crying in the wilderness here. Ralph worked night and day to educate all of us of what was going on in lead in this community. I think that how lucky schools are when they have advocates like that for the children whom they represent. And when Ralph told me that our zip code here, where this school 17 is, was noted throughout the state of New York as being the most lead concentrated area in the state, once we learned that, we were obligated. Because I really do believe that it ranks close on to criminal, that knowing what we know about lead, that we continue to let children be exposed to it. But it was Ralph who worked so hard to do it, and I'm happy for that. And I'm also happy to be here with my good friend, Mayor Bob Duffy. I think right after he was elected to office, we sat down and talked, and he made it clear to me that this was one of his high priorities, and he is certainly following through with that, as is the county executive. And we're so proud of all the great work that she's doing. And I think, as Senator Hillary Clinton says, we are going to be the national model. As I have for many years, I will again lead the efforts in the House of Representatives to get more funding for the HUD Lead Hazard Control Program. It's a program that helps make the low-income properties lead safe, and it deserves all the help we can give it. To that end, I've already called on the Appropriations Committee to provide $175 million, which still is just a drop in the bucket, in funding to the Office of Healthy Homes and Lead Hazard Control, because the current budget slashes the funding to a level which is $37 million below where it was last year, and we can't do that. And even in the face of the difficult budget constraints confronting us, over 60 of my House colleagues have already joined me in this request. Like me, they believe that eradicating lead poisoning must be one of our top priorities, and that you should not put a price on the health of our children and our citizens. When it comes to this issue, we have no time to waste. Senator Clinton made the point so forcefully of the money that we spend on trying to eradicate the cause. After the cause there, we have let go the results of what happens to it. And let me give you just a few of those. She mentioned the 400 children diagnosed with lead paint poisoning here in 2004, and what they have to face are high lead levels that lead to asthma, brain damage, mental retardation, hearing loss, hyperactivity, and developmental delays. In some cases, lead poisoning has even caused seizures, comas, and death in children. How can any of us in good conscience allow a child to suffer those consequences when we know ways to prevent it? The truth of the matter is there's no cure for lead poisoning, but there are ways to prevent it from ever occurring to begin with. We've got to continue to raise awareness and reduce the incidence of lead paint in our communities. Now, I know that we'll all achieve our goals if we give people an incentive to improve the environments of their homes, and we put in place innovative prevention policies. For example, we must ensure that the most vulnerable among us, such as those receiving public assistance, are living in homes that are safe enough for children. I know we can eradicate childhood lead poisoning in the near future, and we must do it, and we are here today to reaffirm the commitment that we have made to this vital goal to promise our children and ourselves a healthier future. Thank you.
Good morning, everyone. It's really an honor for me to be here and talk about some of the things that Monroe County is doing to fight lead poisoning in our community. And I want to say that all of those activities are happening under the great leadership of our public health director, Dr. Andy Doniger, who has been dedicated to this for many, many years. So I'm proud to have him as a partner as well. I want to thank Senator Clinton for being here today and for providing leadership in this area. As has been said a couple of times now, I too believe that Rochester and Monroe County can be a model community when it comes to eradicating lead poisoning in this community by 2010. I was very impressed listening to some of the discussion in the other room. The one thing that stands out in my mind is not only have we made this a priority, but we have the commitment and the solidarity to work at this together, and the collaboration and the partnership, however you want to frame that, we're committed, and I think that really speaks well for our community. Let me just tell you a couple of things that Monroe County has been doing. We're certainly committed to changing the standard that we use to investigate properties suspected to contain lead hazards from the New York State standard to the more stringent HUD standard. And that is a commitment that we promised in 2004, and that's a commitment that we fulfilled. Probably the most important thing that I think we're doing right now, and where we have the most obvious chance of success, I believe, is that we have initiated a free 6-hour lead-safe work practices training program, which I'm proud to report has successfully been completed by 572 individuals in 2004, another 431 individuals in 2005, and we continue to offer this training program free of charge to homeowners, to landlords, and really I think if we can aggressively target that level of activity in this community, I think we stand a better chance of success. Thank you. Monroe County has also committed itself to developing a pilot program of lead safety assessments for properties rented to those receiving public assistance. As Monroe County Executive, we are responsible, as Dr. Doniger said in our roundtable discussion, not only for lead poisoning and helping to fight that battle, but we are also responsible for homelessness in our community. And we have got to make sure that our public assistance housing venues are safe for our children and for our families. The Monroe County Deteriorated Paint Pilot Project was conducted during the spring and summer of 2005. It was designed to assess the condition of the painted surfaces in a total of 30 randomly selected homes. All 30 units, 100% assessed for this pilot project, were found to have deteriorated paint in them. And by making those identifications, we reached out to the owners. The owners of 9 of the 30 units successfully applied for grant money that we have available through the county, $3,500 worth, to help clean up their properties. All 9 have successfully completed that work, including the clearance testing. 9 is a small number, and we can do much better. But I think the fact that we're taking baby steps and have the commitment to do more certainly speaks well for this community. I could go on and on about some of the other things that we're doing, but let me just end by saying that we have a partnership with the City of Rochester and the County of Monroe, and there are a lot of people in this room who are committed to the 2010 deadline, and so I'm very proud to be a partner with everyone in this room who's concerned about this problem. And again, I want to thank Senator Clinton for making this a priority for her. And
when you look at the map for lead poisoning, what do you see? You see a crescent-shaped map that is so synonymous with violent crime, homicides, dropout rates, drug use, poverty. It is in the same areas of our community where we see the same issues over and over and over again. And Senator Clinton made a great point this morning, and she mentioned it up here, about the prison population. As a former police chief, you have to wonder how many young men and women in prison today, if they were tested, will be tested as being lead positive. And you wonder what the impact that had. There's a mom in this audience who lost 2 sons to homicide, who is here today. At least one of her sons was lead poisoned. And the impact cannot be measured. And the costs, which are going to be exorbitant, are necessary because who is being poisoned by and large? It's poor children in our city. Our housing stock is set, actually 60%, 6 out of 10 houses in our city are rental units. Out of that 60%, 70% of those units were built before 1960. So lead paint is clearly an issue. 38% of kids under 18 in our city live under the level of poverty. So looking at those statistics and looking at the mapping of where the lead paint is, we know where it is. It's something that can be fixed. It can be eradicated if we have the will and the resources to do it. And one thing I would note, aside from what we're doing. The city is also, we're training and certifying inspectors. We've made 4 new hires. There's a huge push on for education and communication. Julio Vasquez is here today from our community development. He's our new commissioner with Bob Barrows. They are doing great work. The resources are going out. We want to be able to measure and quantify every step. We need focus. We need to make sure we go at these houses and apartments one at a time. We also have to look for shared responsibility with costs. We cannot drive this investment. And I'm happy to say last week, members of the Lead Coalition and property owners met in City Hall. 2 groups that were at diametrically opposite points of view many, many months ago are coming together, looking at ways they can work together. It is a community-wide effort. And I think today, just looking around the room here, all the elected officials, community leaders, parents, folks from the school district, it's a great testament to this community, because the one thing, I'll just close by saying this. This, to me, has a huge impact on the future of this community and this city. And the good thing is, nobody cares who gets credit. This community deserves credit if we, by 2010, can eradicate lead poisoning in this city. And I know that we can. And again, I want to thank Maggie Brooks, the city and the county, our partners on this. It's a bipartisan effort. It's about children and about families. So keep up the great work, and thank you so much today.
I hope that people who see this on the news, who live in older housing in Rochester, in the county, with young children, will have their blood levels tested. Number 2, I hope that in the homes you're in, whether you own it or you rent it, you will look carefully to make sure that the paint has not deteriorated, that there isn't obvious signs of dust around. But sometimes it's hard to see, so you may need to get somebody who can help you, and Derek and others can give you some advice about that. Because it's not just picking up paint chips and putting it in your mouth that you have to worry about with your toddler. It's breathing the dust. It's playing out in the backyard. It's just being around it. So please have your children tested. We used to think for a long time that if a child's blood level was less than 10 micrograms per deciliter, that was okay. There is no safe level for lead. We've got to try to avoid it and get it eliminated as soon as possible. When the mayor was up here, he referred to the tragic murders of 2 young men whose mother is with us. Dr. Kennedy, who took care of one of the young boys, showed us this chart with this handsome, attractive, beautiful boy, born in 1992. In 1995, when he was 3 years old, he had lead levels of 57 micrograms. Nearly 6 times what people say is safe, and we don't think that's safe. And he was intensively treated. It got down to 23, it got down to 13, it got down to 14. This never should have happened. And it's just one out of the many stories of lost potential, in this case, a lost life. So we just need to do better. And everybody needs to do better. And I hope that the families who are seeing this on television or hearing about it or reading it in the paper will take care to get their own children checked. I saw some children outside who were about to be checked or had been checked before but were back to be checked again. Please do this as soon as you possibly can with your own children.